Cost analyses are always some of the more interesting data you can glean from large databases or registries like the National Cardiovascular Data Registry. And right now I want to introduce you to the Assistant Professor of Medicine, Washington University School of Medicine, St. Louis, Dr. Amit Amin. And we're talking about transradial PCI is associated with lower cost in Medicare fee-for-service beneficiaries following elective PCI. Why did you do this study?
So, I'll give a little bit of background. The clinical outcomes of radial PCI are now really well established. They reduce vascular complications, they reduce bleeding. However, we've always been interested in the economic impact of radial PCI because we know that it reduces bleeding, which is an important driver of costs. But we also know that it changes physician behavior to use different anticoagulants and vascular closure devices. So the bearing of all of these factors on the economic aspect of PCI is not known, and therefore we conducted this study.
Now, you actually combined two very large registries, tied them together for this, correct?
That's exactly right. We combined the ACC NCDR with the CMS. The CMS link was predominantly done to get the cost outcomes.
And what did you find?
So before I delve into that, I'd like to describe that, we have done now a series of economic analyses, and I'd like to describe two of those.
Sure.
The first was conducted in 5 large U.S. hospitals, and we obtained cost data and clinical outcomes data. And in these 5 centers, we found that radial PCI was associated independently with reduced bleeding as well as cost savings. The cost savings was substantial, and they were about $830 per procedure. However, a limitation of that 5-center study was that it was done predominantly in the younger population. And as you know, elderly folks have a completely different set of comorbidities. They have longer lengths of stay, and most importantly, they are at higher bleeding risk. And so whether the same economic findings would bear out in an elderly population was not known, and therefore we conducted this present study. Again, we found the same things. It's really interesting that despite being at higher bleeding risk, we found again a 1% absolute reduction in bleeding associated with radial PCI, and again cost savings of about $680 per procedure associated with transradial PCI. So identical findings.
Why is more radial PCI not done?
It's an interesting question, and I think people are looking into that, but it has to do with training, it has to do with comfort level, but it's rapidly changing across the country. The rate of radial PCI is going up as we speak. Especially the younger folks are more interested in trying this procedure out. And fellows are being trained across the country to at least have some exposure to radial PCI during their fellowship.
Does it take more time?
Yes is the short answer, and slightly more radiation. Again, studies have shown, our NCDR CMS link study again shows the same. There is about 2 to 3 minute excess fluoroscopy time associated with radial PCI.
So that, at the moment, might be one of the factors contributing?
I doubt that's the case. It's just the nature of the procedure that requires a slightly higher fluoroscopy time.
And it's being accepted widely around the world. Let's face it, over in Europe, they've been doing transradial a lot longer than we have.
Exactly right.
So they know what they're doing over there, and are going to eventually change minds, do you think?
I think so. People are adopting it at a higher rate, and that rate's going up continuously, as does the NCDR data also show.
Well, NCDR has been a major source of news and information out of this meeting. For a summary of a lot of that, please go to CardioSource World News. We're summarizing the stories and a lot of the NCDR data for you. I'm the executive editor of CSWN, Rick McGuire.